Bismillahirrahmanirrahim. Assalamu alaikum, dear all viewers. Welcome to my YouTube channel, E-Learn with Technologist. Today is our lecture, which is about blood smear. Blood smear is also known as peripheral blood smear, which is also known as blood film. So, first of all, we need to know what is peripheral blood smear or blood smear. Blood smear is a type of blood test that includes obtaining blood sample. First, we need to take a blood sample from the patient if you want to perform blood smear or peripheral blood smear test in laboratory, and then we need to uh, put a drop of blood sample on slide, and then we need to make a slide from it. But which tube we used for collecting a blood sample for blood smear? We need to collect a blood sample in EDTA tube. EDTA stands for ethylene diamine tetraacetic acid, which is a type of anticoagulant which is present inside the tube, and they don't allow blood to be clot. Then treated with a special stand used for microscopy to check components of the blood like red blood cells, white blood cells, and platelets to see whether they are normal or abnormal in their shape, size, and number. Then, after we make slide from blood sample, then we put a special stand like Gemza stand and Leishman stand. These are the two stand which are mostly used in laboratory. And then we need to perform microscopy of these slides to check whether the red blood cells, white blood cells, and platelets, they are normal in their size, shape, and number or not. Now come towards purpose of blood smear. Blood smear test can help in detection of diseases and the effect of diseases on blood components. Blood smear detects diseases like if we see the peripheral blood smear or blood film in which we see the red blood cells and there is a parasite which is known as malarial parasite. So for that purpose we check red blood cells whether there is a parasite inside red blood cells or not. So for detection of diseases we check components of the blood like red blood cell. We check for malarial parasite. Blood smear tests are sometimes used to check for parasites in the blood that can cause disease or parasitic infection. Sometimes we use blood smear or peripheral blood smear to check or to detect parasitic infection in the blood. For example, malaria, leishmania, which is known as the infection which is caused by leishmania is known as leishmaniasis. Leukemia can be detected sometime due to change in the number and shape of blood cells in the blood smear. We can also detect leukemias because of the blood smear or peripheral blood smear or blood film. Blood smear test can also be used to detect different types of anemias like microcytic anemia, normocytic anemias, and macrocytic anemias. Leukemia can be detected sometime due to change in the number and shape of the blood cells in the blood smear. Blood smear test can also be used to detect different types of anemias. For that purpose, to check different types of anemias or to detect different types of anemia, we can perform blood smear test in laboratory to check whether the anemia is macrocytic, microcytic, or normocytic. So thanks for watching.